I'm a public health doctor, and I started off actually working in general medicine and became very curious as to why people were developing heart disease, cancers, diabetes, and what we could actually do to prevent that. And so I actually then, a few years after working, decided to do a PhD, specifically looking at the epidemiology of risk factors for chronic disease. And that was as a lecturer at a stroke registry. And so during that job, I really got to understand the role of data in public health and how important data is and how we can actually use that for program management, but also ultimately for patient care. And it also taught me lots of skills about how to be self-organized, project management, etc. I then went into public health training, did a medical research council fellowship for health of the population research. And after working in the NHS as a consultant for a while, I was up for more of a challenge and was invited to go to Abu Dhabi, where they were setting up a new Ministry of Health. And so I helped to set up the services, many of them from scratch. So things like cancer screening, diabetes services, disease registries, looking at how to monitor clinical quality. So lots of really exciting work. Really had to roll my sleeves up and get active in that role. But actually, a little bit daunting at the time, moving country, going into a completely new system, and working with people from all over the world. And that I would say was really the kind of that changed my career, because I made tremendous contacts during that role, and actually taught me how to um, deliver public health and deliver health in very different settings. And I learned from all the people I was working with from all around the world, and learning about different systems and different ways of delivering healthcare. So I did that for a few years, and following that, quite kind of surreptitiously went into working freelance, because one of the companies I was working with at the time, contractually, they could only take me on um, uh, as an advisor. And so that started my kind of advisory part of my career. And that was with Thomson Reuters, who had the largest health data set in the world called MarketScan. And again, using my data skills, that was a really fantastic few years working with them, using that data set to really deliver healthcare and, for example, doing benchmarking work, looking at how countries could learn from each other in terms of best practice. After that, I became an advisor to the World Health Organization, advising on how to monitor and manage chronic disease. And they have some initiatives, one of which is the Global Monitoring Framework, whereby ministers of health report their own country's data, and helping to put all of that together. So again, really important, impactful work. Quite different, as you can probably tell. Some of the type of work and the pace of work was quite different from role to role. I now have my own advisory company, and work with governments, NGOs, and also the private sector, really, again, looking at lifestyle risk factors, how you change people's lifestyle risk factors, how you at national level or at system level improve health, and how you prevent chronic disease. And once chronic disease takes place, how do you set up the health system to better manage that? So I'm happy to take questions later about my career, but maybe I'll touch a little bit on what has helped me, I feel, in my career. As you can hear, it's been quite changeable, and that can be quite daunting at times. But a few things that, in hindsight, I think have helped me is really understanding my own strengths and weaknesses as well. So I like data. I like using data in programs. I like to be able to monitor the impact of anything that I've implemented. And so that has been a real strength, being a physician who also understands how to use data. I have many weaknesses as well. And again, avoiding scenarios or situations where I wouldn't necessarily be perfectly or well aligned, or I wouldn't thrive as well. So understanding your own skills, be that your personality, the way you like to work, and your skill set at the time. Saying that I would really encourage lifelong learning and upskilling. So as part of that process, really identifying which skills um, could help you in your future career. And at the moment, I think all of us need to learn more about AI because it really can transform the way we work, not necessarily to work in a different setting, but to really help us to work more efficiently. And also how to communicate efficiently. And I don't necessarily mean communicate on a one-to-one with other people, but how to really put across complex messages. So in academia, we tend to really think deeply, and we're able to speak for a long time on a very niche area, but actually in the real world, we need to do the opposite. We need to be able to explain that complex message to somebody with a reading age of 10 or 12, and to really simplify it and then put it into perspective and the context of the real world setting. So also important, I think, is to put yourself in a position where you can reach the people who, are your future employers and who you'd like to work with. And that means networking. It means using LinkedIn. As Sophie mentioned, it seems that there's a fantastic service that UCL offer to help you to set up your LinkedIn profiles, and really building your network. And part of that is being at the right place at the right time, which means putting yourself out there. Don't be afraid to put yourself out there. Don't be afraid to network with people who are not academics. And you wouldn't necessarily normally go to those types of events. And then the other area is to really look at is moving out of the kind of academic mindset or approach. What do I mean by that? So sometimes being open to working with people outside of academia. So even if you're in an academic role right now, look at opportunities outside of that. Don't be afraid to do work for free. I've done a lot of free work in my career because more often than not, it comes back to reward you. You broaden your network, you learn from the projects, you learn from other people. And kind of tailor your approach, tailor your LinkedIn profile, for example, tailor your CV. So the way in academia we would really look at somebody's strengths and weaknesses is different to how that would be perceived in the real world. And so really maybe have somebody look at your CV and look at your LinkedIn who isn't from an academic background, to see if they can actually help you to tailor that.